Hello there, it is Career Talk on Ogun State Television. As always, we bring you different professionals. They talk about their career field and if possible, they pitch that field to you. And if you have questions or doubt about certain careers, this is the program for you to watch. Today we'll be discussing with a community health professional. He will be telling us about that career option. He'll be telling us what it means to be a community health professional and how to go about becoming one. His name is Mr. Musibau Tijani. Thank you very much for joining us on the program today, sir.
Thank you for bringing me in here to talk about community health profession.
Thank you so much, sir. It's a pleasure to have you on the program. So before we delve into community health as a profession, let's start with your academic background.
Okay. So thank you. So by profession, I am a community health practitioner and also a professional. And the journey started from Ogun State College of Health Technology, where I had a diploma in community health. So I later proceeded to University College Hospital, Ibadan, UCH. So I had a clinical training as a community health officer. So, and then thereafter, my academic journey also took me to Lee City University.
Wow.
So also in the field of community health.
What an impressive CV.
Yes.
Okay,
I'm
now.
not done with that.
Oh.
Yes, I later returned back to UI.
University of Ibadan.
Ibadan. So
the primary university.
I had a postgraduate diploma in monitoring and evaluation practice. So, and then shortly I checked back at the University College Hospital again to have a certificate training program in health administration and management. So as part of what I did, which also reinforced my professional managerial skill. So at the postgraduate level, so I also studied at Abeokuta University of Technology, Lautech.
Wow, okay.
I was one of the pioneer students of MPH, Master of Public Health students. So at pioneer sets. So and it came at that time. I was there when this protracted crisis of Lautech happened. We've just finished our project when the strike occurred. So, and it took us almost extra 1 or 2 years before we were able to finally concluded the program. Then I'm also an alumnus of University of Lagos, Unilag.
I was actually waiting for that. That all this university, and you did not attend my very own University of Lagos.
So I was at Unilag in Yaraba, the College of Medicine. So where I had my MSc in public health as well. So I did the general public health option. So and after that, I also returned back to, there's an institute in UCH. We call it a Center for Training of Health Sciences.
Okay.
Center for the Teachers of Health Sciences.
Okay.
So I was there as well, where I have become a certified instructor as a trainer of community health and primary health care workers. And presently, so I'm with Uniports.
Okay.
University of Port Harcourt.
How do you do that? From Abeokuta to Uniport?
Yes. You know, the journey for seeking knowledge. So there's common saying that you seek knowledge even as far as China. So you go anywhere to look for knowledge. So since people are traveling outside the country to schooling, so Port Harcourt is still in
Nigeria, right? So the distance should
so
not be a barrier.
Now, of course, not a barrier. Presently now, I'm running my PhD program in epidemiology. So I'm at the phase of my field work.
Okay. Wow, interesting one.
Thank you.
Very impressive CV.
Yes, yes,
Okay,
yes.
so who is a community health professional?
So now, before I defined, give you a definite definition of who is a community expert, let me provide you some background that led to the what we have now as community health professional or practitioner or community health worker. So when you look at evolution of Nigeria health system, we started from somewhere. Now we have teaching hospital, secondary general hospital, primary health care facilities, federal medical centers. It doesn't just happen in a day. It's a developmental process. It started pre-independence. And pre-independence, the health system is dominated by our colonial masters. So most of the doctors then they are white, and the nurses they are non-Nigerians. These are people that started most of the our flagship facilities like University College Hospital, Lut Idiaraba, and some other holding, our forefront health facilities in Nigeria. So, but the issue that at that time is that most of these health system, health services focus around these colonial masters. So they are not planning for Nigerian masses. They plan for themselves. Even when you look at it, it's only people that are close to their office that will have, maybe you are working with them, that you have access to the modern health services. So majority of our fathers that then depend majorly on our traditional medicine. So the adage say the Yoruba they say iṣẹ́ lè ró àgbo àgbàrá àgbo lọ̀ṣun fi ń wọ ọmọ rẹ̀ dókítà ó tó dé. So at that time,
Can you, in a way, translate that in English?
it means that before the advent of this modern medicine, our fathers in Africa, we have our own medicine, call it traditional medicine. Now they are calling it alternative. It's not alternative, it's our traditional medicine. So our people have a way of caring for people even before we have all these hospitals. There was a time there's no any hospitals in the whole of Abeokuta. Before the whites came, the missionary follow and begin. So when we have the independence, so Nigeria now begin to plan for their own heads, the heads of the citizen. So we have a lot of reform, a lot of developmental policy, health policy now come up from 1963, so 1968. Thereafter, the war in the civil war came, destroy a lot of things, and then those period characterized with a lot of deaths. People are dying. Pregnant mother on daily basis. Children are dying. They call what you call ajakale or àìsàn tita. When you see children in a particular community, like 100 in a week, children died. So a lot of we have the worst health indicator.
Then,
in terms of maternal death, in terms of death, children, infant mortality, in terms of death among the elderly, a lot of people are dying. And the governments begin to look at can we improve the health of our people. So they try to build facilities in some of the cities. State hospital started at Abeokuta General Hospital started. So Ijebu-Ode and some other places, they built hospitals, employ training. Now there is a transition. So most of these foreign doctors are leaving. So we have some of our people now being trained as a doctor, as a nurse, they are taking over gradually. But this health system still concentrated more majorly in the city. What is happening in rural area? They are messing of them. Nobody to look after them. And you should know that proportion of people that are living in rural area, when you look at the geographical, in terms of habitations, you see that more people are living in rural area than in urban. Even statistically, we have up to maybe like 65 or 70% of Nigeria are residing in rural area. So it means that they only cater for about 30 or 40% of people. So we still have a lot of people in the rural area that they don't have access to healthcare services.
Please hold your thoughts, sir. I'm enjoying the I'm enjoying the historical background that led to community health development and professionals.
Yes.
But before you delve into who a community health professional is, let's take a quick break. Right now, we'll be taking a break. Let's hear out the young minds. Let's know what they would like to be in the future. May their dreams come true.
I like to be an astronaut in future because I want to travel about the galaxy to explore more things in the world and know more about scientific reasons and maths.
Thank you for staying with us on Career Talk at still Ogun State Television. And I'm still discussing with Mr. Musibao Tijani. He is a community health professional. Sir, please continue. You're about to tell us how your profession came to limelight. Yes.
So we have fewer doctors, fewer nurses, fewer health facilities, and majorly concentrated in urban area. So when a woman, like my grandfather, no, not my uncle, said the wife died from miscarriage in our village, to travel to the city, it may take like maybe the whole day. So the woman started bleeding in early pregnancy, and before they will carry the woman from the village to the town, the woman has lost a lot of blood. So eventually the woman died from that complication. This is just an example that, because I used to ask, what happened to your first wife that's born our elder brothers?
So this situation led to
a lot of children will die. So a lot of issues are happening with access to health facilities, and then now come to around 1970s. Then globally, the thinking is shifting to bringing healthcare closer to people, to where people are living, and access to healthcare become the order of the day. And Nigeria being also part of the global community, so our ministers, government representatives attend international and see what is happening in other countries. The WHO is now leading, providing guidance for people to expand their healthcare services that cover majority of the citizens. So we have our late professor Abeokuta started at Lot in the Araba. He began to experiment and how do we bring health services closer. See that in public health, there's what we call a tip of iceberg phenomenon. It means that, what does it mean? That when you sit down in an hospital as a doctor, or as a nurse, people come in. What we are seeing in your facility there is a tip of iceberg. Majority of those cases, they are in the community. For everyone that presented with a particular condition, my sister, thousands of people are in the community suffering from the same condition, but they are not yet coming out.
Okay, so now tell us.
Now think of how do we now.
So I want you to just tell us who a healthcare professional is.
Okay, so let me just try to conclude that story I'm trying to narrate. So he now come a Professor Abeokuta now, fortunately later become a minister for health of the federation. So learning from other country, begin the introduction of what we call primary health care, which means bringing health care service to everywhere, universal access, universal coverage of health care services. Now, irrespective of wherever you are, you must have access to health care. So it's now gradually until around early 19, we have a formal and official launching of primary health care in Nigeria during the regime of former General Babangida as head of states. That was time We have the Olukoyeka Sankote as the of the blessed memory as the minister for health. So what they now did is that to look at it now, we now have to bridge the gap, creating another special set of health worker that will fit this gap, because we know that our hospitals, we can't pull all our doctors and put them, we don't have enough, we don't have enough nurses. Even those ones that are there, they say, okay, come and go to rural area. Who will leave Abeokuta and now be working at in the rural area? So people are some resistance. Said we have to now sit down and decide, okay, let us try to create another brand of set of health care workers that will be purposely trained, deploy into the rural communities and to the grassroots. Then they begin to build health facility. Those people will be working in those facilities, managing up to 70 or 80% of the cases. Then those that are now become serious ones, they will now be referred to the general hospital and teaching hospital. And this is how what led to the creation of community health as a profession. So it's still very young, around 1970. So the cadre came up. The federal government came up and created a special cadre. We call them a polyvalent health workers. Because they are going to be the only one working there as a nurse. They will be the only working there as a doctor. They are only laboratory. They are also going to have a laboratory personnel. No pharmacy there. They should be able to, and they are going to engage the community, provide health education, provide support health promotion activities. They have to be polyvalent. Multitasking, because here you will be alone, you will be the one to take delivery, you'll be the one to treat malaria, you'll be the one to give,
and they are qualified to do all that.
They do that. So government
are they qualified?
Come up, yes.
Okay.
So government now come up with a curriculum and then establish a training institution for them. That's what we call College of Health Technologies.
Okay, so that's going to bring us to the next question.
Yes.
For the young ones that are interested in this wonderful story and this informative, the information that you've given to us about becoming, about who a healthcare professional is. So how should they go about becoming one?
Okay. So if for those that are interested in becoming a community health practitioner or a professional or community health worker, so first of all is to have your normal university, the normal higher institution and entry requirements.
Okay.
Minimum of 5 credits.
In WAEC or NECO.
Not more than 2 sitting. English, mathematics, and physics, chemistry, biology. So once you have those one, then now before there was no JAM, they conduct their own entrance exam by themselves. Then now they are introducing. Some of them also, you have to also sit for JAM. So once you meet with cutoff, then you do the screening, then you can be once you did well, you will be sure that you will get admission. Admission to study what exactly? Study community health.
Are those courses available in all universities?
Basically, is the training started with colleges of health technology.
Oh.
Because the intention is to train a middle manpower that can handle primary healthcare services, referring complications to secondary and tertiary facilities.
Okay.
Yes, it's now. So they start at a diploma level as the College of Health Technology. Then we call it School of Health Technology. Now they are already upgrading to
universities.
So, but now, so we are now having degree programs in community health that they can now go directly into university to take their JAM and enter. But this program is structured in such a way that when you have your diploma, you can start practicing. So then when you proceed to the next level, I will tell about the various cadres we have in the community health profession.
Please do.
So for now, we have about 3 cadres of community health workers, community health professionals. So, and the training is structured in such a way that It's kind of the certificate you have that determine the cadre you are going to fall in. For the if you in the College of Health Technology, there are two sets. We have the community health extension workers.
Okay.
So we have the junior and the senior community extension workers. For the junior community extension workers, these are people that they spend 2 years and they have a certificate and the certification examination as a junior community extension workers. So for those other kids that they spend senior one, they spend 3 years. So after the 3 years of their study, they will be qualified as senior community health extension workers, and they will sit for the qualifying exams, and they will also be licensed to practice both in the clinical setting and also in the community.
Thank you.
So now, moving beyond that, those that are now qualified as senior community health extension, the next level of training is the community health officer training, and that is now situated in the teaching hospital.
Okay. You find community health workers in teaching hospitals
The training.
undergoing trainings as well.
Yes.
Interesting.
The training now in Southwest, we have 3 institutions that providing the training for community health officers.
Okay.
So we have the UCH Ibadan,
University College at
Ibadan,
Hospital,
yes,
Ibadan.
Ibadan. We had LUTH
Okay.
in Idiaraba, then Obafemi Awolowo University Teaching Hospital at Ile-Ife.
Okay, the LUTH, that is Lagos State,
Yes.
Lagos University Teaching Hospital.
Yes.
And the third one,
That's Obafemi Awolowo University Teaching Hospital at Ile-Ife.
at Ile-Ife.
Yes,
Okay.
these are the teaching hospitals because the community officers are now have to be well equipped to manage some complications, some more serious cases. So, and also provide the leadership. So their training is not happening at the College of Health Technology. It's now at teaching hospital training. So they train them along with medical students and other nurses.
Health professionals.
Health professionals. So to be well equipped. Because by structure, they are the one that is going to man and coordinate the primary healthcare services by the training. By their training and their background. So they are the one.
But with your own CV and the academic background that you gave us here, with all those qualifications, are you only restricted to managing primary health care?
No. So we provide community health services.
Okay.
So when you go to most of our teaching hospitals there, they have a community health department, community medicine department. So they work with the community physicians. So they work with them in teaching hospitals. And when we go to some of our, even in private practice, we have some of them that are also into private practice, operating clinics, and they are also being coordinated and regulated by the departments in charge of monitoring the private practice at the Ministry of Health.
Okay, so are there areas of specializations for community health workers, or they just do it all?
For the area of specialization, so at the level of, say, community health extension worker, I call them a polyvalent. They don't say, this is where I'm specialized, I cannot manage. Because the primary health care...
But your PhD is in epidemiology. That's an area of specialization.
Exactly.
Yes.
So you can decide to now take an area of specialization by the time you get to postgraduate level.
Okay.
Just like in medical profession as well. So
you study general medicine first.
Then
okay.
At the postgraduate level, you now decide which one you want to specialize. So we have some of our people that will specialize in community health education. Some will go to community nutrition. So I choose to follow the line of epidemiology.
Wow, that has been so informative. Thank you very much for joining us on the program. But one last question before we go. Your advice to the young ones, those that have not made up their mind on what to be in the future, or those who are already in a career path, so just your advice for them.
Thank you. My advice is that we have some people that they will be waiting after secondary school, sitting for JAM this year, not meeting up with the cut-off mark, receipt again, and then somebody will spend like 3-4 years still at home in the name of I want to enter university. or want to enter, to going for one course. So what we need to do is to start from somewhere. So you can start at College of EdTech, have a diploma. Your diploma will be a direct entry. Direct entry, you enter into university, you have your degree you have your degree. So after your degree, first degree, you can go for your second degree, third degree, and then you can come anything you want to be in life.
Thank you. Thank you very much for us. We have to go.
So
we have to go on career talk. Maybe you have to come back on the program because I'm beginning to get interested too. Thank you very much, Mr. Musiba Otijani, for coming on Career Talk. It's been quite informative talking to you. And thank you too for watching Career Talk at the Ogun State Television. Thank you for always keeping it locked here. My name is Lara Emmanuel, and next time we'll be bringing you another interesting career option. See you another time.